Yilungelo sawubona mbukeli sesifikile thina nentandokazi yohlelo oluthandayo Yilungelo Lakho. It's your right, we're coming to you live like Mamba phambili SABC 1 njengenjwayelo eMzansi for sure. Namhlanje mbukeli the 31st of August ilanga lokuthi lapho sibungaza khona usuku lwemithi yekulapha yesintu phecelezi it's African Traditional Medicines Day. Lolu suku ke mbukeli lubungazwa kulo lonke izwe lalapha eAfrika. Mina ke ngumajalu alisho inhlanhlo igama ngithi mbukela sibhekisise le ndaba sifakela ama specs. Bukela umnyango wezempilo la eningizimu Afrika uthi babalelwa ku-80% wabantu abasebenzisa imithi yokwelapha yesintu la eSouth Africa. Okunye-ke phela okubangela lokhu ukuthi le ndlela yokwelapha 1 ishibhile kanti futhi itholakala kalula. Kodwa-ke ngabe sesihambe safikaphi phela nokubeka imithi yokwelapha yesintu yendabuko ezingene elifana nayo lenye eminye imithi yesilungu ngaphambi kokuthi mbukeli singene edabeni lethu sibhekisisa ukuthi izivakashi zethu zithini ake sizwe ukuthi nini emgaqweni nithini.
We know how traditional medicine has treated us before due to our forefathers and our ancestors, but we can't really say the same about Western medicine because it's constantly evolving and it's constantly changing. We don't know the side effects that we might have to deal with 20 years from now because of the medicines we take today.
We can turn back to our roots and use African medicine, we'll be fine.
The Western medication is made from the African one.
The role of traditional medicine in fighting diseases is firstly cost, because it costs less and it's easily accessible for poverty-stricken areas and people.
Some people do not believe in using traditional medicine as they believe that it's superstitious or fiction.
Some people believe that this medicine are not scientifically efficient.
Alright, siyabezwa kabantu ukuthi bathini mayelana naleli suku mbukeli kanye futhi nalamakhambi okulapha esintu. Manje ke ukhuluma kabanzi ngendima phela yokwelapha yemithi yendabuko masamukele lapha ku Zoom sinaye we are expecting uPhepsile Maseko ovela kwinhlangano iTraditional Healers Organization, and we are also expecting ku Zoom uDr. Khosile Hlape, yena ke he's the president of the Health Professions Council of South Africa. Kanti ku Skype sinaye insizwa lapho khanda Msibi yenake uvela kwi 360 Global Solutions Group. Asiqale ngawe Bhuti Khandani, thank you so much for joining us. Sakwamukela ohlelweni insizwa. Sithemba ukuthi uphephile during this trying times as a pandemic. Awusichazele kabanzi Bhuti Khosi, Bhuti Khandani, awusitshele kabanzi what does 360 Global Solutions Group kahle kahle nenzani yini umsebenzi wenu baba?
Ngiyabonga kakhulu dadewethu Alicia and good morning kubalandeli bohlelo and happy African Traditional Medicines Day. I360 Global Solutions Group inkampani eyakhula from iDoves Group okuyi funeral undertaker, safaka insurance company, safaka medical aid administration, safaka retirement fund administration, i-salt, safaka asset management, accumulate, and kwaba khona nezinye inkampani sizifakayo njenge Lumsa Financial Services, but of late sifake i-biotechnology, and kwi-biotechnology sifake i-360 biopharmaceuticals ebhekane namakhambi wesilungu, safaka i-360 biomedicine ebhekane namakhambi wesintu. Khona inkampani esayithenga kwaZulu Ingoma SA, sathenga 100%. It's one of the companies that we own. And then amanye amankampani esibhizi ngayo i-360 nuclear medicine ne-360 medical equipment. So i-360 Global Solutions njengoba igama lisho, we see ourselves not only as a company serving South Africa, but inkampani ukuthi it will serve umhlaba wonke jikelele. Kungakho uma ubheka kwi-pharmaceutical nakumakhambi, we are not specialists in any area sithathe wonke ama-areas esaziyo ukuthi ayabanceda abantu, and we put them into one group.
All right, very interesting and progressive news there. Let's welcome Dr. Khosile Tlape yena. He's on the line. We're still trying to see him lapha ya kuZoom. Ama-technicians wethu asasihlanganisa nalawo ma-visuals. Doctor, thank you so much for joining us today. Awusichazele kabanzi, tell us a little bit about, I know for the benefit of our viewers, tell us a bit about the mandate of the Health Professionals Council, sir. Dr. Khosi? All right, Dr. Khosile Tlape, we're still going to try and get hold of him. Let's try uPepsile Maseko yenake ovela kwi-Traditional Healers Organization. Pepsile, thank you so much for joining us. Mangabu khona online awusitshele kabanzi ngenhlanganiso wenu ukuthi kahle kahle nenzani nini umsebenzi wenu.
Okay, ngicela kubonga kakhulu lithuba lenisiphe lona namhlanje. Nokuthi futhi esikujabulelayo ngokuthi siku program yenu ekhuluma ngokubaluleka kwamalungelo abantu. Siyinhlangano ke yabelaphi bendabuko thina sikuma province wonke oyi9 oyimfica. Umsebenzi wethu omkhulu kakhulu ukuthi si organize noma sibuthezele abelaphi bendabuko, sibuthezele abantu abasebenza ngomuthi wesintu, sibese sesiyaba register, sibese sesiyabaqeqesha ikakhulukazi abogogo noma abelaphi bendabuko ngoba sikholela ekuthenini i-curriculum yakho osuke uphuma nayo ephehlweni nale reality lo bese uyayithola ngaphandle kwephehlo in the practical life situation. Kufanele ukuthi sikwazi ukuthatha le theory yasephehlweni nale practical reality lo suke ufacene nayo bese ke sikwazi ukukuncedisa nokuthi understand ukuthi iziphi izona lezifo ezikhona ngesilungu omhlambe kungashiwongo okanye ungafundiswanga ngazo ngesikhathi sephehlweni. So thina siletha siba i-bridge phakathi kwale mikhakha emibili kodwa i-focus yethu kakhulu i-clear. Sifocuse ekuthuthukiseni abelaphi bendabuko, ekuthuthukiseni umuthi wesintu nasekunqenqeni onke amakhampani akhuluma ngomuthi wesintu okukhulunywa ngokuthi kune traditional knowledge. Sithi amakhampani anjalo akazi ngokuthi ayazuza imiphakathi lakhona agubha khona leyo mithi noma athatha khona umuthi.
All right, Sis Pepsile, we're going to get into more details about umsebenzi wenu. Let's try out Dr. Khosile Tlape. Dr. Tlape, thank you so much for joining us, sir. A little bit about Health Professionals Council, Baba. If you can just explain to us ukuthi kahle kahle umzimba wenu wenzani.
Well, the Health Professions Council is a regulatory body that regulates the multiple professions. Yes. That would include doctors, dentists, psychologists, psychiatrists, physiotherapists, dental assistants, inspectors, laboratory technicians. So we have just under 30 professions that we regulate. And our duty is to regulate their education, their training, the curriculum content, professionalization, license them to practice, and we also look at complaints about their behavior. We are responsible to ensure that they update their skills, continuing professional development and the discipline of the members that register with us.
All right, thank you, Dr. Imbukeli. Uyazwela ke lapho ukuthi inhlanganiso zethu ivakashi zethu siniphathele zona namhlanje zenza muphi umsebenzi. Ake sithathe ikhefu ke sizobuya emva kwaleli ikhefu Mbukeli singene odabeni lethu njengoba bengishilo ukuthi sibungaza namhlanje i-African Traditional Medicines Day. Sizoke sixoxe siza ukuthi le inhlanganiso esinazo namhlanje as ama-guest wethu bahlangana kanjani ukuthi phela sazi ukuthi nina mase ufuna ukuthi ulapheke noma ngabe ugulo kwesintu noma ngabe ugulo kwesilungu ulapheka kanjani. Yilungelo Lakho back shortly after this. Welcome welcome back. Iliphi iqhaza-ke ocabanga ukuthi lidlalwa umuthi wokwelapha wesintu? We are talking about this as we celebrate African Traditional Medicines Day namhlanje. My guest on the line, Dr. Khosile Hlape, the president of the Health Professionals Council, uPhepsile Maseko, yenomele i-Traditional Healers Organization, kanye nobaba uKhandani Msibi, CEO ye-360 Global Solutions Group. Mbukeli, we are live. You can call us on 011-714-6918, alternatively 714-6919. consumer@sabc.co.za is our email address. Sikhona futhi on Facebook as well as kuma SMSs and on WhatsApp. Keep on sending those WhatsApp messages. Now, Doctor, maybe let me start with you. I mean, to start off, today being the 31st of August is a big day for African traditional medicines across Africa. Any specific significance to this day, especially for the Health Council, Doctor?
Well, the significance is that in Africa, we have far more traditional practitioners than those that are trained in Western medicine.
Yes.
Most Africans get their care from traditional healers. And we are part of taking care of population and trying to restore people to health and to maintain good health. Mm-hmm. But we fully understand that the majority of people on the continent access traditional healers.
Absolutely. All right. And when I Phepsile, I mean, ilanga elikhulu namhlanje mengiqala ngivula I-show, ngikhulume ukuthi kuthiwa about 80% of the country's population kuthiwa ithembele kulamakhambi ngoba number 1 alula ukuthi atholakale, number 2 futhi ashibhile ukuthi bawasebenzise. So lichaza ukuthini leli langa kunina Ntokazi?
Ngiyabonga kakhulu. Into echaza ile langa nje okokuqala nje sifuna ukuthatha lethuba sibonge kakhulu kubo bonke abantu abadla umuthi wesintu eSouth Africa. Sisho ukuthi kulocwaningo olwenziwa ngo-2007 olwenziwa iSouth African Health Review oluthi abantu eSouth Africa bayi-72% basebenzisa umuthi wesintu. Siyathemba ukuthi nangabe kungathiwa leyonziwa locwaningo namhlanje ingenyuka kakhulu intengiso yemithi yesintu futhi ngenyuka kakhulu ukudliwa komuthi wesintu. Konke lokho siyakwazi kwenziwa ukuthi abantu bakithi abaningi bakholelwa kakhulu ekuthenini bafuna ukusebenzisa umuthi ongonabo ubungozi obungako emzimbeni wabo futhi umuthi owakhelwe esintwini sakubo ngoba umuntu mekekhula okanye umuntu makaqala avuleka amehlo uyafuna umuntu ukuthi azi kakhulu izinto ekudala zifihlwa kubona. So abantu abaningi kungako namhlanje bafuna ukusebenzisa umuthi wesintu. Okunye ngakubeka futhi lana ngokuthi umuthi wesintu ngaphandle kokuthi udliwa ngabantu abaningi nje eSouth Africa ubuye futhi unikeze imali enganga 3 billion ku GDP yelizwe. So kusho kona ukuthi asisibo nje abantu, sibuye siqashe abantu abaningi, sibuye futhi sisize kakhulu ukutakula uhulumeni. And siyavumelana kakhulu no Dr. Lihlapi ekuthenini sibaningi vele abelaphi bendabuko abosompilo abaningi kwendlula isilungu. Kungako kubalulekile ukuthi sikwazi ukuthi isystem yethu yokwelapha asikhone ukuthi siqeqesheke kahle, asikhone ukuthi silethe ezempilo nokunyango kwabantu okusezingeni singadlali nabantu ngoba baningi abantu abathembele kuthina.
Absolutely. Maybe let me just quickly go back to the doctor before I go to you, Khandanani. Doctor, maybe very quickly there. I mean, the numbers, the figures are staggering there. 80% of the country's population relies on traditional medicines, but I mean, this is a huge percentage in consideration of the fact that traditional medicines are still not formalized into our pharmaceutical spaces as well as platforms. So what do you think needs to be done to try and bridge this gap to formalize these medicines, Doctor?
If you look at what we do, the key values in what we do and our interventions, it's about safety, effectiveness, and accountability.
Yes.
And I think if those that are involved in traditional healing bring those principles into what they do about safety, effectiveness, and accountability, it would take it into the next level of recognition. It would also be about, the practitioners themselves. Is there standardization is the vetting of whether they are capable of what they say they are capable of.
Absolutely.
And we need to break up with tradition and transcend that aspect of being able to assure the public that if this person says I'm a traditional healer, how do I ensure that this person is of good quality, is vetted by peers, and it's safe for me to practice with them, to consult with them? How is this person accountable? If I have an unfavorable encounter with them, where do I go for recourse? Those issues become important. So the issue of safety, accountability, and effectiveness are paramount so that traditional healing can come into the modern day era as well.
You know, Doctor, uyibeka kahle ngempela because I'm sure a lot of people bayibuza ukuthi njengoba abantu bebaningi kangaka abasebenzisa lamakhambi kanti yini le vimba ukuthi singathi mesiye ekhemist esitolo sangakithi ngifike ngilithole ikhambi. But Khandanani, awusichazele nsizwa ngazi noma usiphathele imithi lapho ama products eniwenzayo esintu. Mhlawumbe ungasikhombisa and maybe tell us ukuthi what goes into ukwenza lamakhambi eniwenzayo njengoba esho udoctor la ukhuluma ngeindaba zokuthi okokuqala imithi yenu kumele kwenzakale kuqiniseleke ukuthi isafe, there's accountability and also effectability. Ositshele wena nsizwa ukuthi nenza njani ukuthi nenze sure ukuthi you are compliant with these guidelines udoctor qeda ukuzibeka.
Ngiyabonga dadewethu, awuthi ngiphawule ngalokho okukhulunywe udadewethu lapha naye umfowethu.
Yes.
I think for me this is a very sad day in the African traditional medicine. It has remained where it was. And Dr. Klape talks about the safety and efficacy. And Western medicine now, ibuya from the same level where African medicine is today. Right? To start with, medicine as a traditional way of healing. Every community in its primitive state had to have its own medicine. I mean, the Westerners used to drill people in their heads, headaches. Yeah. It's not like our traditional healers are doing anything different, except that there was oppression of the development of traditional medicine. It is satanic, it is not right, and it stayed where it was. So if you can just imagine, if any practice remains what it was for hundreds and hundreds of years, it can never be modern. How can it be modern? And what has driven Western medicine is exactly the lie in Africa. Our brothers and sisters were taught Western medicine. And instead of using the knowledge, how do you make it safe, right? And how do you test efficacy? Instead of easy food as mnyama, to go back and begin to implement what they have learned from Western medicine in order to develop African medicine. They haven't. They are throwing these things at us. And you compare that with China. China has the University of Chinese traditional medicine, which means that they are taking their medicine into the modern world. China we're not, because all our practitioners, this health practitioners council, if a doctor were to dare engage with the traditional healers, license. So there are strong barriers. You look at the development of private hospitals over the past 25 years. More private hospitals that serve white or Western medicine were developed. What was developed for African traditional medicine? Nothing. Nothing is on the ground. There is no investment that is going into it. Our sister says here is 3 billion rands for 80% of the population. The 16% of the population, the amount of money that goes towards that healthcare is over 200 billion rands. Now, how do you develop something that only attracts 3 billion rands against something that is attracting 200 billion rands? So we need all of us to be serious about the African traditional medicine if it is going to develop and we can benefit from it.
All right, but Khandani, I hope ungiphathele amakhambi lapho because I just want to see some of the herbs. But after the break, but Khandani, hold that thought. After the break, I want you to take us through some of amakhambi eniwenzayo khona lapho e360. Let me just quickly take some of your Facebook messages before siye khefini. Usonwabile Vincent Taitai uthi traditional healers should obtain certificates in order to operate and not use dirty alcohol bottles for their medications. Otherwise, they do their part in helping people. Uthi yenake use sprayed. Uvuyelwethu Chona eqichi. Uthi the Western doctors are undermining traditional medicines. And Kamelang Baruti says, but before the arrival of Western medicine, the public relied on a traditional medicine. So very varied views there. Mbugeli wena uthini ungasfonela ku 011-714-6918, alternatively 714-6919, consumer@sabc.co.za. Siyabuya emva kwaleli khefu ungayindawo Mbugeli, will back shortly after this. Today we still siyabungaza Africa Traditional Medicines Day njengoba kumhla ka 31 August. My guest on the line, Dr. Jose Letlape, the president of the SA Health Professionals Council. Intokazi uSiphepsile Maseko yenake umele Traditional Healers Organization. Kanti la on Skype sinensizwa ubaba uKhandani Msibi yenake CEO ye360 Global Solutions. Do get in touch with us. The magic number 011-714-6918, alternatively 714-6919. Consumer@sabc.co.za is our email address. But Khandani, bengisakubuza before siye khefini ukuthi mhlambe amakhambi eniwaphathayo nina ungasichazela baba ukuthi what types of amakhambi do you manufacture, and what is the process that goes into ukuthi nenze la makhambi, and do you have access kumalokhuzana kuma formal sectors like your pharmacies and amalokhuzana ama chemists ukuthi nikwazi ukuthi nifake la makhambeni?
Thank you very much, my sister. I think in explaining our products that we make, if you can imagine and this is us,
yes,
4 stages of African medicine development. The first stage is where abantu bakha, and I use Umhlonyana as an example,
yes,
because Umhlonyana has been able to promote African traditional medicine ngenxa ye-COVID. And ngisho nodokotela nama-scientists bawuthatha Umhlonyana this time because the Western medicine did not have the solution in time for this. So the first part is Umhlonyana, abantu abawukhayo, bawutshala emakhaya nobawuthwele from a traditional healer. The second part is where you take the same plant and process it, cut it into pieces. And this was done by Konuta Tuetu. She runs a company, Bizwai House of Indiza. Kona Amatie that she makes,
yes,
and it's different types of herbs, including Umhlonyana. And then Tina Wingoma, Sensei Umhlonyana from the extracts. Here, this is a process whereby you take out the juices. The part yokusebenzisa in a traditional sense, you cook it yourself, and then even a day you make it like once a day. And then with this one, it's a process of extraction where we take out the active ingredient. The fourth part is a project that we have with the CSIR,
yes,
where we've agreed that they will take Umhlonyana and develop it into a pharmaceutical product.
Okay.
Now, Tina, what 360 Kolelo Ekteni, wonke amakhambi wesintu must go through that process. Ngoba these Western pharmaceutical companies, ziyafika lana zithatha amakhambi and steal the IP and go make drugs and come and sell us those drugs at a higher amount of money.
Yes.
I mean, if you're to Google Umkalabo and the pharmaceutical companies that are exploiting our IP, it's a major thing. It's a German company that is taking Umkalabo. Our problem is that izifundiswa zethu are locked up in a Western medicine processes, but they are not coming out and implementing the systems in order to develop African medicine. And that's where our challenge is.
Sisiphepsile ake sizwe kuwena Ntokazi. I mean I know ukuthi uke waba kulomzabalazo ukuthi nizama ukuthi nilwelwe amakhambi nendlela phela yokulapha yesintu ukuthi ibe formalized ingene eindaweni zamakhemisi ingene ezibhedlela. If I remember there was a time I think a while back kwakuthiwa kwaze kwenziwa ngisho izinto ku TV kwenziwa ama TV dramas ukuthi kuthiwa mungene esibhedlela if ugula you can then be offered ilokhuzana i-option yokuthi uconsulte umuntu wakho uyi-traditional healer yakho inyanga yakhe isangoma sakho alongside that western medication but asazi ukuthi kahle kahle yaphelelaphi leyo ndaba. Awusitshele wena Ntokazi yini kahle kahle enivimba ukuthi nikwazi ukuthi informalize le sector ingene phela nayo emakhambini lawo esiwatholayo esilungu.
Okay, angibonge kakhulu nje nisho ukuthi uma sibona amakhampani afana nabongoma.
Yebo.
Sithi umsebenzi wethu omningi wekwenza advocacy noma wokukhuluma nokukhuthaza abantu ukuthi badle umuthi wesintu siyawubona kubongoma because ngamanye ama-companies atholakala sathuthuka ngokuthi abantu bebathi mabezwa sikhuluma ngomuthi wesintu nabo bathi mabezwa ipassion yethu yokukhuluma ngomuthi wesintu babona ukuthi kubalekile ukuthi bayithathe up le industry. So siyathanda ukuthi akungabi ingoma kuphela akube nawo wonke nje abantu abafuna ukuzibona bazithuthukisa bathuthukisa nemiphakathi yasemaphandleni.
All right.
So siyabonga kakhulu kodwa okunye engizokusho inako thina-ke singabelaphi bendabuko ikakhulukazi siyi-THO ekuphoqiseni kwethu kunento esibiza ngokuthiwa i-consortium agreement. Indlela yokusebenzisana phakathi kwethu njengabayelaphi phakathi kwama-producers amakhambi emithi and then nama-university onke sihlanganisa ama-universities abangu-17 in fact ama-research councils okufaka phakathi i-CSIR because ngiyakholwa ukuthi uzawukhumbula ukuthi i-CSIR beyinomlando nje wekuthathwa wokutshontsha ulwazi lwabelaphi bendabuko.
All right.
So batshontsha bohudya nayeminye kodwa-ke esikwenzile sabe sesithi asisizwe i-department ye-science and innovation kokuthi sikwazi ukusayina isivumelwano kokuthi mangabe ungumelaphi ufuna ukuyocwaninga ufuna ukuqala ibhizinisi efana nengoma nephephisa ikhampani eyakha amakhambi kufanele kokuthi usizakale nemanyuvesi and then ukwazi ukucwaningela. Kodwa la khona sikhuluma khona-ke ukuthi thina-ke asingafani nabantu besilungu. Isilungu sithi umuthi mawunikezwa funeka ukuthi u-isolate the active molecule ngoba lento loketshezi olu-isolatwayo alushoyo ubhuti Khandani. Sithi thina cha sifuna umuthi wesintu usetshenziswe uphelele ngoba uyasiza lokho sihluke kanjalo nebesilungu. And sabesele sesikhuluma manje ne-department uminister omusha sikhulumile naye sasho ukuthi kunale ingqinamba esinazo azibalile nanaye ubhuti Khandani sasho ukuthi laba besilungu laba basentshonalanga sebasicindezele iminyaka eminingi asinayo nebudget asinayo nemithetho engamela nje ukuthi ukwazi ukurejista umuthi wakho wesintu uyimbiza nje. Kufanele ukuthi usebenze kufanele ukuthi uzo-extract ema-molecules
okay Sisiphepsile.
So savumelana ke emsakazi seniceda.
All right Sisiphepsile. All right you Ntokazi. All right we're going to have to work together. Siyabuya khona manje. I'm going to have to cut you off a little bit because we drew for a quick ad break but before we go there ithi nginikeza ama-tweets uqale nang baruthi uthi traditional healers and western medicine must work collectively. Ubhutiza uthi ndicacele and inamba yamaloya anceda abantu abatyelwa imali. Okay that is something else. Moment Momondlovu uthi no most of the traditional medicine isn't tested and proven right. Western medicine is tried and tested. You can trust it. But traditional medicine works as well. But I don't see the need for it to be integrated. Very interesting views. When I'm Lutini, 011-714-6918 or 714-6919. Yilungelo Lakho live on SABC 1. Nomangoloso Majali. We're back shortly after this. Yilungelo, welcome back. The 31st of August being, of course, a traditional African Medicines Day. Namhlanje yona sibungazayo-ke. Sibuza ukuthi nina nicabangani ngokuthi le sector yemithi yesintu phela i-integrate ifakwe lapha emakhemisi ukuthi ungaze phela nawe uhambe kakhulu ukuze uyofuna imithi. I-number to dial 011-714-6918 or 714-6919. On the line, we do have our first caller, Insizu Putumsani, Mtubatuba. Putumsani, thank you so much for joining us. Singakusiza kanjani namhlanje? Putumsani, are you on the line? Tumsani? All right. Tumsani, sisazokuzama Nsizwa, do call us again, 011-714-6918 or 714-6919. Is he back on the line, Tumsani?
Yeah, I'm on the line.
Kunjani Putumsani?
Ngiyaphila njani?
Ngiyaphila Nsizwa. Singakunceda kanjani namhlanje uthini wena ngale ndaba yokuthi abantu basebenzisa amakhambi esintu kodwa siwathole emakhemisi?
Cha, impela nami ngiphatha kakhulu le ndaba ngoba lamakhambi ayasiza kakhulu.
Yebo.
Ngoba mina nje ngingomunye wabo kodwa ngisebenza kakhulu ngokomoya kodwa ngiyawaphatha nayo. Kunento engifuna ukuyicacisa abanye abelapha bayazi kodwa bayebalekela ukuyikhuluma.
Yebo.
Imithi iyalapha kodwa iyaphela amandla awo uma isingena kwi-commercial. Imithi eminingi angikhulumi ngembiza.
Okay.
Ngikhuluma nje imithi makuthiwa sibuka isingena kwimboni yakho nasiyajula.
Kwenziwa yini lokho Putumsani? Bashintsha indlela eyenziwa ngawo mhlambe?
Cha, kuya ngengichaze nakho. Umuthi ngokomthetho isihlahla siwumuntu, siyisoul. Mangabe isihlahla usiphiwa bakini, lo mphefumulo usukuthengela ukuthi wena memukulisa wesiphiwo, khuluma nalomuthi ubike emsamo bese ngoba isihlahla sinegama, siyoyenza leyo duty yakho. Manje masakungena kwi-commercial market like isinjengamaphilisi. Amaphilisi are different, are not a gift, it's just an information. It's not about the information, it's about the soul, helping other souls.
Okay.
Imvelo soul yonke, imvelo yonke iwumphefumulo.
Okay,
Putumsani. Uthatha ulwazi olubhalwe phansi bese befuna ukwenza into ebayithola komunye umuntu by that information igcina asasebenzi into njengoba kwenza amaphilisi.
Siyabonga kakhulu Nsizwa lapho ubaba uDumsani eMtubatuba. Very interesting point there. Dr. Letlape, maybe let me come to you. You know, he mentioned something and he said that, you know, he did it with a bit of a disclaimer. He says traditional healers will not tell you that once you take umuti, a traditional medicine, and you commercialize it, it loses its power. He says for traditional healers and traditional herbs, they are working with the soul. So I want you to first comment on that notion. And then this is my question that is really directed to you, Doctor. In terms then of the legal or regulatory guidelines as well as processes, maybe then paint us a picture of how a medicinal product lands on the shelf from production of my pharmacy. And would that same type of process also apply then to the traditional medicine, or it would be a totally different scenario, which is why we're seeing this impasse that we're seeing now, where most traditional herbs are not found in pharmaceutical companies?
I guess the difference is in Western medicine, things have become industrialized. And it goes back to the issue that he's raising, that industrialization makes it lose effectiveness. That would be something that's subject to proof. But that's the main difference, is that they are able to industrialize in Western medicine. So we need to create our own standards, but we also need to move into the modern era. That notion of if it becomes mass-produced, it loses effectiveness, it needs to be investigated. And if that is true, we'll be limiting ourselves to say we can't progress to be able to become industrial conglomerates and compete globally and be able to export our product. Because if we've got to export it, we've got to find a way of preserving them so that effectiveness is maintained. I think the same thing can be said about Western medicine, that people then find innovative ways of putting preservatives so that it does not lose the active ingredient, but it can be preserved, it can be mass-produced, and it can be taken elsewhere. And I think one of the mistakes that we should not make is to lose our originality.
Absolutely, Doctor, yes.
For example, why should we subject traditional medicine to SABC? Why are we not creating a traditional medicine regulatory authority that can then engage with the practitioners, engage with that industry in terms of what are the standards to be set. Why do you want to impose white standards on something that is African? Why don't we create African standards and commit to modernizing them according to our own core value systems?
Thank you so much, Doctor. Sisiphephsile, maybe jump in there quickly njengoba uDoctor eqeda ukukhuluma lapho ukuthi why abantu ama-traditional healers nabantu abenza imithi yesintu yindaba kungenziwa umnyango ozobhekana nale mithi nalo mkhakha so that abantu bangakhona ukuthi bethiyaziseka uma esitolo azi ukuthi uma ngifuna umuthi wesintu ngiyalapha ngicomplaina lapha ngenza ukuthi nokuthi mengalaphekanga ngenza ukuthi and also ucommente kule khola eshoyo ukuthi uma sesithatha imithi sesiyithaka sifake emakhemisi izobe singasasebenzi ngabe kuyiqiniso lokho uthi uDoctor kumele ku-investigate lokho.
Okay, no, angibonge kakhulu ngalokho kodwa ke phela angithi ihlelo lenu igama layo ilungelo ngelakho shuthi unaye ukhola unelungelo lokuthi angazibekela nje ngendlela yakhe ngoba nasingabe singabuka ukuthi i-evolution lesibuya kuyo yokudla yemithi yempilo nje even including inkolo the religion ukuthi iqalephi uzobona ukuthi uma uyitracer from Africa unyuke nayo iziyogcine west so kusho ukuthini ke lokusho ukuthi abantu bebelima ekuqaleni for subsistence balimela nje bona nemindeni kodwa as the world developed babona ukuthi abanye abanawo amajarithi kufanele ukuthi masilima silimele wonke umuntu so kwagcina se-commercializwa kanjalo kufana nasemthini angeke siloku sihleli sibancane and yet sina so much resource kodwa singakwazi ukuyishare nelizwe so ngasho kanjalo okwesibili-ke kunento eshiwo udokotela uLihlaba Dokotela uLihlaba siyabonga kakhulu hayi sowuthuthukile kakhulu kusho kona ukuthi umsebenzi wethu advocate usebenzile iminyaka yonke
Okay, Ntokazi. Hold that thought, Ntokazi. I want to quickly take a caller there. We've got James from Pretoria. James, are you still on the line?
I'm still on the line.
Kunjani but James?
Ngikhona njani wena?
Ngiyaphila baba, singakusiza kanjani sibuza umbuzo wakho sizowuphendula emva kwekhefu.
Mina indaba yami ukuthi le mithi yesintu imithi yemvelo sivela nayo siphuma nayo sibele chayikhona le mithi kodwa namhlanje laba besilungu babuya bathi le mithi yethu abakhulu kuyo bekuthi nabo labantu abenza imithi yesilungu labo baphilise yiyo le mithi yesintu manje abasitshela ukuthi le yabo bayithatha kuphi labafuna ukuthi sikhole kulo ngoba eyethu yesintu ngineqiniso ukuthi bona ngwawo nje bakhulisiwe nabazali bathu babo bakhulisiwe abasitshela ukuthi yabo ivelaphi.
Okay, siyabonga babu James Mbukeli. If you still want to say something now very quickly, so sithatha ikhefu lokugcina 0117146918 or 7146919. Hey, ibhizi ngempela le ndaba as we celebrate Africa Traditional Medicines Day. Sibheka ukuthi yini kanti ekumele yenzeke ukuthi lamakhambi athathe aformalize industrialize abe ne-access ukuthi wonke umuntu mefika ekhemisi akwazi ukuthi ayithole. We back shortly after this. Ungayindawo. It's our final segment. Sisabungaza ilanga le Africa Traditional Medicines Day. My guests in studio, Dr. Khosile Tlapa is on the line, the president of the Health Professionals Council, Phepsile Maseko, we Traditional Healers Organization, Pudkandani Msibi, we CEO ye 360 Global Solutions Group. Pudkandani, ikola lana iti ama Western medicines, they've totally undervalued traditional medicine to a point where ngathi kuthiwa omunye usebenza kangcono kunomunye, whereas thina as Africans we grew up uyasho uthi sakhula ngamakhambi uthi nabo baba bethu no baba babo no mama babo babekhula ngamakhambi esintu. So why this differentiation yokuthi manje the other one is better than the other one? And then maybe usinikeze amalokhuzana what you'd like to see in terms of ukuthi kiwa phambili, in terms of industrializing and formalizing and integrating traditional herbs into the formal sector.
Ngiyabonga siswami. Oqala bangiphawule with the earlier conversation ukuthi imithi uma iba commercialized iluza effectiveness. There's a reason why there's a shelf life. Shelf life means beyond a certain point it is not effective. So that answers that. And the second layer we must have a separate regulatory body for African medicine. I don't agree. Because now we're creating a homeland for African medicines as opposed to integrating them into the current system where we're spending the most money. Right? It's not true that it's not quite true which it's Western medicine necessarily.
All right.
Hello?
Yes, very quickly, Butkandan, your 2 minutes is up.
Okay. No, my 2 minutes is not up. It's not true that Western medicine has oppressed African traditional medicine.
Yes.
It is our healthcare professionals, because for you to get medicine, it is a doctor that prescribes.
Yes, that's true.
So, and it is our own doctor that have not seen the need to integrate with African traditional medicine.
Right.
So we need integration so that uma sithi esibhedlela ne uma ugula fanele bakwenzele ukuthi mawufuna traditional medicine uyithole. But uma umongikazi engayazi African traditional medicine uzokunceda kanjani? Uma udokotela engayazi uzoprescribe kanjani? So
Thank you so much, Butkandana. I'm going to have to cut you because ngisafuna ukuza Doctor. Doctor, very quickly your closing statements there, and maybe comment on our final caller who says Western medicine iyona engathi iba abantu undervalue ilokhuzana traditional medicine. Doctor, are you still on the line? All right, I think I've lost Dr. Letlape on the line. Sisiphepsile, Ntokazi awuvale uyeza ukuthi batheni before siye ekhefini ukuthi sikhule ngamakhambi kodwa manje ngathi le eyabelungu eyesilungu sekuyona ekuthiwe ngathi ingcono kunale yesintu. Uthini wena Ntokazi lapho? Sisiphephile? All right, it seems like sengwaluzile ama-guest wami Dr. Letlape on the line, as well as uPhepsile Maseko we Traditional Healers Organization. Mbukeli, that is where, unfortunately, where we're going to leave it today. Yilungelo Lakho. Let me thank my studio guest, Dr. Letlape. He is the president of the Health Professionals Council, Phepsile Maseko, the Traditional Healers Organization, and of course, Ukhandani Msibi, is CEO year 360. Is the doctor back on the line? All right, we have a caller. Let's take a very quick final caller on the line. Nkuluma nobani?
Hello.
Hello.
Hi.
Hi, how are you?
I'm beautiful. Yourself?
I'm good, thank you. Who are we talking to today?
You are speaking to Dr. Seheri, and I'm a herbalist from University of KwaZulu-Natal.
Yes, go ahead, doctor.
I'm also a traditional healer.
Go ahead, doctor.
Many people have covered many points, but they have forgotten one thing.
Yes.
It's important for us to not let the Western medicine take over our traditional medicine.
Why,
It's
doctor?
important for us to remember that we have always been using traditional medicine and it cannot be interfered with.
True.
That is the only point I want to put across.
But doctor,
it's important that we stop undermining traditional medicine.
Yes.
I'm 40 years old, 22 years in the field, with a degree in herbalism. Right now, the World Health Organization has now told me basically that my degree is useless. Imagine you go to university for 7 years and you come back and you're told that you cannot give lengana to people. Well, we know it works. It works on children, it works on adults. I'm just going to make an example with that only because who has made a point to undermine us, and it has to stop.
Thank you, Doctor. And Doctor, maybe the stigma around the use on its own of traditional medicines. I mean, if you come to work uqabile or nugimpepo, already people are going to start saying things and thinking of you in a certain manner, of which is not a nice thing also. So we also need to have those conversations around stigma as well.
Like teaching our children to be confident in themselves being African.
Absolutely. Doctor, thank you so much for that call. And of course, those views. Mbugeli, unfortunately, that is where we end today's discussion. Let me thank my studio guest once again, not studio necessarily, Dr. Hosile Tlhape joined us on the line. He is the president of the Health Professionals Council of South Africa, Pepsile Masego, a traditional healers organization, Nobabu Kandani Msebi, CEO ye 360 Global Solutions, Bonage, Ibona, Aba manufacturer, all those traditional herbs. Mbugeli, that's where Umajali leaves it for this time. Join us next week for another live consumer discussion. From myself, Ntombi Agajali, nisale kahle, nibe right. Happy Africa Traditional Medicines Day. Bye-bye.